So, in terms of developing a blueprint, we know that sharing experiences and best practices is key. Dr. Pereira, can you talk us through your direct experience working on the Genomas Brazil and National Programme of Genomics and Precision Medicine and what the lessons learned have been?
Yes, and thank you so much for the opportunity to participate. And I think Dr. Estrada made a very important point, which is, before we can fully profit from all the potential of precision medicine to better management of individual and population health and decreasing of costs, we need to understand the genetic basis of common diseases in non-European populations. And in order to do that, we need biobanks, we need these platforms like the UK Biobank or the All of Us or FinGen, where we will have health and genomic data from hundreds of thousands of individuals of these different populations. And although we call ourselves collectively Latin America, our populations vary a lot from country to country. And we need that in order to find and develop polygenics risk scores that are precise. They're more precise for our populations because most of what we have now is based on the genomes of populations of European ancestries. And so when the first articles came out showing how, the lack of diversity on genomic databases and studies, and how that was impacting the application of precision medicine in non-European populations. In Brazil, we concluded that it was a good opportunity to try to put together a large project to generate the data Dr. Estrada was mentioning. And some years before, a colleague of ours had created the Brazilian Initiative for Precision Medicine, which was the first initiative in Brazil. And since Dr. Isia couldn't get funding to generate data, what she proposed was to create a platform where all the researchers in Brazil that had generated genomic data would deposit their data in one centralized place. And that was admirable. And however, we needed to generate the data in a very consistent and harmonized way where we would have genomic and health data. And you need those two parts in order to make the discoveries. So in 2019, we launched the DNA do Brasil project, which had this mission of including the Brazilian population in precision medicine by starting to create this infrastructure for discovery. And these projects, they're very complex if you look, and expensive and complex. And in Brazil, we have this national public health system, which could be leveraged to create something like the UK Biobank that is all based on the NHS. But since we couldn't, get enough funding to collect both health data and genomic data, what we decided to do was to take advantage of cohort studies that were already happening in Brazil, where we had groups of Brazilians that were very well clinically characterized already by some researchers in different universities. So we made collaborations with these groups that already had some health data, and we added the whole genome sequence to that. And that was the start of what became a national program on precision health and genomics, the program Genomas Brasil from the Ministry of Health. And it is actually a collection of different genomic projects. You have the DNA do Brasil, we have one initiative on rare diseases that is led by the Albert Einstein Hospital in Brazil, and one in cardiology, And so this is one way to move forward, and it will be very important and very impactful, mostly for the cohorts that are being studied. But there are some challenges in analyzing the whole data, you know, the sum of all the parts, because mostly because of the lack of harmonization in the way the health data was collected. And mind you, this is actually, you know, collection of good health data is actually, I think, and please, if my colleagues don't agree, feel free to argue with me, but I think that's the greatest challenge is that. The challenge in generating the genomic data is a financial challenge. It's, and you know, it's a matter of getting the funding and everything. But putting together, you know, all the clinical data and all the health and lifestyle information in a harmonized way so that you can analyze all the groups together, that's a big challenge. And this is something that we in Brazil still have to figure out and invest because of the way that this Genomas Brasil project is being built as a collection of smaller projects.
And just as a follow-up, Dr. Pereira, can you visualize what the solution to that might look like? Is there something that you can work towards? I mean, it seems like there's an opportunity to kind of get it right before it's done on a large scale, but what might that look like?
I think it needs a lot of political work and the community getting together and with the Ministry of Health and showing them, listen, we have the public health system, so let's leverage that and, you know, look at the UK Biobank model and how can we leverage that, because all that health information that is already collected by the public health system, that's very valuable. And so it's a matter of getting the right people together and building this framework.
Yeah, thank you. So I'm going to open this next question up to all of you. And it sort of follows on from what you've all been saying, but what questions do you think need to be addressed to ensure that success for not only successful, but a sustainable genomic medicine program across regions? Does anybody want to go first?
Okay, I can do it. I will try. In my opinion, the questions should be addressed in key areas: infrastructure, policy, ethics, education, and community engagement. In order to optimize the benefits of genomic medicine in Latin America, considering the special needs of the region, which are very particular in some cases. In fact, I made a list of questions I think we need to answer. For example, what strategies are required to address gaps in funding, technology, and laboratory facilities in the region, considering political and regulatory differences, as Dr. Pereira says? What policies need to be established to regulate genomic testing, clinical application, and ethical practices as well? How can genomic research and medicine address existing health disparities in Latin America, especially in different countries and in rural and urban areas? What are the barriers to integrating genomic data into routine clinical workflows? How can they be overcome? In this respect, we, for example, published a paper in 2023 about this issue in pharmacogenomic field for Latin America and the Caribbean, with very interesting results. What partnership, public, private, regional, and international, can be leveraged to support genomic medicine program and basic clinical research? what framework are needed for data sharing among countries and institutions as well. How can genomic medicine programs respect cultural, ethical, and social contexts in diverse Latin American populations, including Amerindians, which is an important point and concern? How can genomic literacy be improved among policymakers, clinicians, and general public? I believe that addressing these questions is vital for developing genomic medicine in Latin America. We will also need to engage diverse stakeholders and fostering regional collaboration to maximize the impact of precision medicine here in Latin America.
Thank you. I mean, it's great to have all of those questions. I think what's coming across loud and clear is that you're all very aligned on what needs to be done. It's just a case of how do we achieve it now. Did anybody else have anything to add to that? Dr. Moreno?
Yeah, no, I totally agree with all those points. But I think a key ingredient in whatever direction we move forward, it will only be successful, in my opinion, if we work hard to keep the leadership locally in each of those regions, countries, efforts, whatever it is. Because I think the world is getting the point. The whole world is getting that the priority is there. So there's not a lack of priority at the global scale. And they know that diversity is important to go towards no European populations, and they will go after them. They are going after them, right? So it's not the lack of convincing globally the scientific community. I think that we have to be prepared locally to really play in a fair, kind of a fair play with those international partners. I'm not saying no to international collaboration. No, the other way around. I think we need to build bonds and bridges with international partners, because otherwise, I mean, if one thing we have also learned through all these years that our local governments will never support enough at the scale that we needed our local projects. So we need to some extent, join forces internationally. But again, we need to keep leadership locally, because otherwise the benefit of all those science will go somewhere else. And if that happens, we lose a big opportunity of strengthening our local capacity. That means training, that means students, that means infrastructure, really knowing how to do those big projects locally. I think it's a big key ingredient to be successful.
Yeah, I think that is really important, and it sort of leads very nicely into the next question. So thank you for that. Again, open to anyone, open to the floor. What opportunities exist for creating links and collaborations both amongst member states and regional stakeholders and international partners, and how can we better foster and promote these collaborations? But perhaps with a mind to what you've just said, Dr. Moreno, how do we collaborate globally but drive locally these solutions?
Well, maybe I can just continue with that idea, if I may.
Yeah.
I think, I mean, some of the work is already kind of ongoing already, and several collaborative networks have been formed in the past few years. And I think we should take advantage of those networks. I mean, there's many societies for human genetics in each of our countries. They have a lot of presence locally, but there are also regional ones that have been joining this, for example, RELAG, which is the Latin American Human Genetics Network. It joins several human genetic societies of, for example, Chile, Uruguay, Mexico, Colombia, and so on. And I think leveraging those networks that has already, stakeholders and researchers that have the knowledge of the local communities it's a way to join forces at a bigger scale. I can mention, other networks, one that I have been co-leading together with Ricardo Verdugo from Chile, for example, which we call Latin Genomes, and it's very open for every other researcher to join. I've been primarily trying to seek precisely in a similar spirit to what Dr. Pereira said. Let's find out what's already there. Let's try to put together collections of cohorts or samples or data that's already existing and try to put together ideas to combine them. It could be through a platform. It could be through a reference panel that, people can access to impute their data. It could be through joint grant proposals. But the idea is to not start from zero in every single region, but, try to start from there's already some ground. And there's other initiatives that even a newer one recently launched at the Latin American Human Genetics Congress in Guadalajara in Mexico, which is called Latinomics. It's more oriented towards diseases, more that, as opposed to Latin genome, which is more the population genetic scale of panels available for genomic studies. But so on. There are several networks that I think should be already leveraged to try to put together joint proposals and move this forward, trying to keep the regional leadership in Latin America. And I think that's the only way forward.
Thank you. Did anyone else want to add into that?
Yes. Beside the network Dr. Moreno mentions, in the case of pharmacogenomics, we have some organizations such as Solfagem, which is the Latin American Society of Pharmacogenomic and Personalized Medicine, and also RELIVAF, which is Latin American Network for Implementation and Validation of Pharmacogenomic Clinical Guidelines, and some other international collaboration with CPIC, PharmGKV, UFAR, all of them addressed to help to provide and support framework and data to better advance in pharmacogenomic and genomic medicine in Latin America. We need to reinforce this network and fostering new collaboration. International partners are essential in it. Furthermore, the collaborative research in clinical trials with genomic or pharmacogenomic components would be very good, as well as to generate, for example, pilot project to demonstrate cost effectiveness of genomic medicine and pharmacogenomic tools in Latin America. This is important because of the financial situation of sanitary systems are always important. Besides, of course, is necessary to ensure additional funding from national governments for genomic medicine. I think in this respect, maybe PAHO can be a crucial role for that.
Thank you. And Dr. Ribeiro, would you like to add into that too?
Yeah, I was wondering about the necessity to be informed and well educated about the technical topics, but it's not enough, the technical topics and the genomics or the pharmacogenomics and all these things. You need to, the legal framework, you need to, the ethical analysis, and for example, the HTA, the Health Technology Assessment, people. I feel in many ways in Latin America, we have people, but not enough people educated in all these areas. So if you want to grow with this topic, you don't have to be only thinking about the technical issue. You have to be a broader vision about this problem, because if you want for many different countries to get access to this, almost all the big countries have to make a health technology assessment before they are paid for the governments. And maybe if the country has a lot of different levels of income and the disparity is too high, you have to make an ethical and equity analysis too. And the legal framework is not something that you have to put out, and you need to examine all of this in a very strong framework. And maybe, like the Professor Moreno said, you need to grow with the people in the countries, maintain the contact with the networks, but you have to grow in the educate all the people on these areas that I mentioned before.
Thank you.